Hello, everyone. This is Dr. Khan. I'm going to go ahead and bring Michelle on again. Yeah. Is this better, Michelle?
Yes.
Yes, yes. Now this is back to where we were. Now it does happen. It has happened, unfortunately, before. So hopefully the connection is good. Now, what you mentioned again, to recap for those listeners who are coming back on again, what you said, and if you can summarize, because I think you can say it a lot better than I can. What is it that went through your head in order to make the decision in regards to what these other six plastic surgeons were saying, and how you chose differently because you changed your mind and you were determined by talking to, you said, hundreds of other women, and where you were as a young lady determined to proceed with a decision that was different than what was professionally given to you by these plastic surgeons. So please tell us what was going through your head.
What was going through my head was that I felt like I did my homework, and I wanted to make sure that if I'm showing up and trying to be a better person and healthier and eat healthier foods and work out and drink water, why do I have these toxic things inside of me, and what am I waiting for? So I just started to constantly think about everything that was happening, and it was working against me instead of towards me, and I didn't want to live like that anymore. I was constantly going to bed and being like, oh my gosh, is this because my implants? I was constantly like, not feeling well, and it's like, oh my gosh, this is my implants and my anxiety. It's like it started to rob me from my life, and I didn't want that to happen anymore. So it was a very easy decision. Like, if I know that I have a 50% chance of walking outside right now across the street and I'm going to get like shot, I'm not going to walk outside across the street. You know what I mean? Because I don't want that to happen. So I want to make sure that I got them removed as quickly as possible, because it's very important for me to be healthy, to have a healthy body, to take care of myself. And with those inside of me, I was told by a lot of people that it derailed their quality of life and gave them a lot of toxicity, in which actually takes a little bit of time to get out of your body. So
Right, right. And I tell the patients it takes you some time to get to where you were with the breast implant illness, and certainly it takes some time for you to recover. Now, I want to go ahead and share with you. So I operated on a patient last week. She's a nurse practitioner from Ohio in the medical field. She got implants on the 18th of December, 2021. So just 8 weeks and 4 days prior to her explant. So just 2 months and 4 days to be exact. And lo and behold, as I knew going into the surgery, she's a 35-year-old lady with a set of implants, just 64 days, the one and only set, silicone under the muscle. And lo and behold, the pathology came back as chronic inflammation, giant cell reaction with refractile light that is noted within the capsule. And this is consistent with Dr. Henry Dykman's research, where the gel bleach starts occurring from day one. And lo and behold, she was feeling sick and ill. And in just a week after her augmentation, she went to the doctor, to her hospital, and this is the #1 major hospital in her home state, where they said that she has what is serum sickness from what are an allergic reaction to Keflex antibiotics, to her surprise. And this is what was the working diagnosis, and she knew from her research it was indeed the implants. Now we're going to hear from her, and the feedback initially that I've gotten is that she's feeling better, she's doing better, and we will hear from her. We'll let another few weeks go by, but looking at the pathology report, I actually just today did a 1-minute video, and you will see exactly the detrimental effects of the implants just from within a couple of months. Now I'm curious to see, did her plastic surgeon discuss with her the 3 FDA warnings that are supposed to be highlighted by plastic surgeons for anyone who's getting augmented, especially after the October 31, 2021 mandate, where The FDA has said that the plastic surgeon needs to sit down with the prospective patient and say, number one, implants are not meant to be in the body forever. Number two, they are associated with lymphoma, especially the textured ones. And number three, they are associated with what is breast implant illness. And I will be very curious to see what her feedback is. Now, what you said was, it took some time for you to get to your breast implant illness before you realized that, the implants are hurting me, and you did your research for 6 months. I want to highlight something very important that you said for my listeners, for the prospective patients. You talked to hundreds of patients. This is where you did your homework. Your mind overrode what the next MD was saying, the plastic surgeon, because you knew better in your heart what you needed to do better for yourself, and not that the system determined what your health was going to be. Meaning you knew the implants were bad, they were hurting you. Now, the next question is, please tell us, how did you prepare for the surgery?
Good question.
Yeah.
It's a mindset thing again. So if I sit there and tell myself that this is going to be so hard and this is going to suck, like it's going to suck. So I was like, how can I go into surgery the biggest bad ASS ever, and healthy and fit and strong, and how can I do it? So I'm like, my water needs to be on track. I need to make sure I'm getting all my vegetables and fruit, like just all the things, you guys, that like over and over again, it's annoying to hear, but the things that make you feel good and that your body truly needs. It needs protein to recover. Like I needed to make sure that I was ready to go into this. And for anything, it was my mindset. So I just said, I'm going to do great. I'm young, I'm healthy, I have help, I have support. And honestly, 190% getting my breast implants in at 19 was a harder surgery than getting my breast implants out at the age of 33. No joke. But I also am a lot healthier at my age now than I was then. So I will give you that. But still, it's again what you tell yourself. This is literally a computer system. It's our biggest and strongest muscle that we have. I know people think it's your biceps. And what you tell this to do, it will automatically do. It might be on delayed, but if you tell it you're going to binge this weekend, you're going to binge this weekend. If you tell them the surgery is going to suck and you're going to look like crap, that's what's going to happen.
Right, right. You are, I will tell you, and so in the medical world, believe it or not, and this is well published and well studied. So patients who are about to undergo major surgery, so like say a triple A, which is the abdominal aortic aneurysm surgery, or other big surgeries, just like anything in life, if you're mentally prepared that you're going to do fine and you're going to fly and you're going to do excellent, believe it or not, that's 90% of the recovery right there. And I cannot, you explained it and you nailed it, and you could not have said it any better. The mindset, and I'll tell you, going into the surgery, just like anything in life, you're going to get your gallbladder out tomorrow, but you're mentally prepared that you're going to bounce back from it, you're going to be happy, and you're going to be successful, and you're going to fight this. Meaning you're going to overwrite and you're going to be in control and not let the system be in control. I'll tell you, that in itself is 90% of the work right there. And that mindset that you said it so well. It's been studied, and there is ample data out there that shows going into anything positive, you're going to get a positive outcome, versus if you go in negatively thinking that you're going to sink, then unfortunately the negativity overrides the mind. And that is something very important. And I'll tell you, very, very important.
Personal development. And Dr. Khan, you don't know this. Tomorrow I'm having surgery again. 2 weeks after I had my implants taken out, I went to get my acne checked, and I have skin cancer on my face, and I'm having surgery tomorrow on my face. And I'm going to have a scar probably this big. And everyone's like, again, it's my mind. Like, I'm going to go do my thing. I'm going to work out. I'm going to live my life. I'm going to look at myself and tell myself 500 times that I am beautiful. Like, it's what you tell yourself. It's known as personal development. I know we look at people like they're crazy. They're kind of weird, because I used to do that, but it's changed my life to flip the switch and take control of your emotions. And it's not easy. I'm not saying it's easy, but when you do efforts, 5-10 minutes a day of reading books or listening to podcasts or listening to an Audible book, it goes a long way.
See, one thing that I admired about you when you came in as a patient, I remember room number 5, you were so positive, and you were already like determined. You knew exactly what the next step, because you had done your homework, and I admired that. And this positivity, this positive energy in life, this is what you need, not only in surgery, but let's say the next endeavor, the next business move, the next let's say, oh, like say a flight that you're going to take and say, you know what, I think I'm going to miss that flight because, no, but you're still positive about it. And I think that carries in life a long way because it makes your outlook positive in general. And I have to say, just hanging around you will make me positive if I'm negative. And I'll tell you, that goes a long way in real life, not having to do anything with BII, but in general with many things in life. And so that is very important quality and personality trait to have. Very important. And this is
Thank
the
you.
personal development that you're talking about.
Because I was not like this.
Now tell us what, once you knew you had your date, I know you were very excited about the surgery. The other thing I want to mention is many patients are nervous, if not all, just like anyone is after any surgery or before any surgery. But the excitement, I will tell you, one of my other nurses was mentioning, and my first assist was mentioning, that almost all your patients are very excited about the surgery because they know literally they have good health waiting right around the corner. So how did you prepare for the surgery itself? Like meaning physically, as far as what did you do?
Well, again, I did my homework because I wanted to know exactly what happened the second I walked in that door. I'm the kind of person where, like, I want to know what's going to happen. So I want to walk them through that because I think that's kind of important. You go into surgery. Mine was at, 6 o'clock in the morning. You walk in, they give you a gown. They ask you to go to the bathroom and take a pregnancy test. You pee in a cup. So don't go to the bathroom before you come home, and make sure you're properly hydrated the night before. Like, before you have to stop drinking liquids, drink water that entire night, because guess what? It's going to make your IV better too, because when you're hydrated, your veins are hydrated, and it makes it very simple. I couldn't even feel the IV. After the pregnancy test, everything is pretty fast. You go into the room where you sit with the nurse, who is darling, and they're all the same people. You only meet like 4 people, and they're all the same, and they're with you the whole time. And she was young and bubbly and really sweet. And she did the IV, and then she just asked me medical history. And that was like 20 minutes. And then Dr. Khan comes in, and he just, is there. And I was nervous, and everyone was very happy. And he did the pictures beforehand, and then they just wheel you back, and you wake up and you're like, oh my gosh, like, and then you just have snack and you get to go home. So, like, I don't know. That's exactly what happens. Like, your husband gets to hang out, or your partner, they get to go get your prescription. And then when you get there, you have it. So, like, if you're in pain, when you get out, you can have it. And that's another thing, like Dr. Khan, follow directions. Like, if it says to take the medicine, like, I listened. So I didn't want the pain to kick in, and then you can't catch up. Because I look at it as, okay, maybe you're holistic and you're against pain meds, but I'm also against getting surgery and sitting my butt in bed and getting bedridden for 72 hours, because you're going to become stiff, and a body is meant to move. So I got up after surgery, and I even walked circles around my house for 6 miles every day.
Mm-hmm. Now, I will tell you, very important. I want to go ahead and emphasize what you just said, kind of from an MD perspective. So just today, I talked to a patient. She came from Georgia, and she was walking around her house. No, I said, I want you to go do the real walk. Go outside, walk in like the like an open area. It's getting warmer here in Michigan. Go take some nice deep breaths. When you walk, you release the endorphins from your muscles, helps with the mentation, the gut, the breathing, overall recovery. The second thing you mentioned here is, about the anesthesia part. Your dad is an anesthesiologist. You come from a family of anesthesia people, doctors, and the team. What you mentioned, even in the video feedback that you gave, that your anesthesia team member was there from pre-op, intra-op, and post-op, such that there was continuity. And that person, Kirsten, she never left you. We never leave you, meaning we're there with you from the beginning to the very end. Now, this is one thing that I want to highlight is the Twilight Anesthesia, which is the sedation or the conscious sedation. Now, tell us, how was your experience overall?
Amazing. It couldn't have gone any other way.
Yeah. So this is where you're sedating. You don't remember anything. You are in twilight sedation. The pain control is there. The amnesia from the surgery itself, once that you sit down on the OR table to the time when you recover, everything else in the middle, you don't remember. And this is where the patient is not paralyzed. We have the SCD boots on, and the circulation is there that helps keep and prevent any deep vein thrombus from forming, versus general anesthesia where you paralyze the patient and now you have a ventilator breathing for the patient. Now that is still safe, but this is very safe and safer, if you will, because the patient is essentially breathing on her own, and the patient is able to maintain her own airway, and the patient has, again, very comfortable anesthesia, very sedated patient, and the patient bounces back because this is very effective and safe, comfortable anesthesia, which is not dependent on the ventilator breathing for the patient, where it is related, where the general anesthesia is associated with deep vein thrombus forming, ventilator associated trauma, for example, among other things, which is still safe, but this is what I would say safer. And I tell all my plastic surgery colleagues, this effectively can be done very safely. I did a case at the hospital. I go talk to the anesthesiologist and they're like, we're going to do general. I said, no, we're going to do sedation because it is. And he said, all this time, I said, absolutely, it can be done. And he was semi-retired at the hospital, and he himself, I think for the first time, he did this sedation, conscious sedation, very safely, very effectively after all this time. And remember, the patient got the best experience, the best bounce back, and again, very safe, very effective, and the patient had no recollection. And as you will see, the many ladies that will come forth and say they actually literally snore through the surgery if they're snorers, very safe and very effectively done. Now, the other thing I want to mention here is, you want to remain well hydrated. As a physician, as a clinician, I will say the average human body needs 6 to 8 cups of water. Now, obviously, if you have kidney problems, heart failure, heart issues, blood pressure, that's separate. But every patient, young, energetic, healthy, be it in their 40s, 50s, you need water. Water is life. And you need that water to remain well hydrated. Remember, you're going to basically remove the excess. You are going to urinate it out. And so it is normal and healthy for the skin, for the body to remain well hydrated, especially when you're going to be having surgery tomorrow, the next day, and you want to be hydrated the night before. And for some patients, especially if they're number 2 or number 3 for the surgery next day, it's just you're having a late breakfast. So we normally sleep through the 8-10 hours of sleep that we normally get. And to remain well hydrated, it is very good, very happy. The patient is also very happy in the morning if they're well hydrated. Now, tell us more. So once you were in recovery, what did you do like post-op that helped you, that what you can help our patients understand, not only my patients, but other patients, so that they can basically benefit from your experience?
Well, the water was huge, and 6 to 8 ounces on 6 to 8 cups. I think it should be more. It's in my boot camp,
at least, yeah.
half of your weight. And then if you drink coffee or tea, you need to replace that. So for me, I'm 150 pounds, 75 ounces, but I drink 2 cups of water. So I have to add 16 ounces. So it's 91 ounces a day. So drinking water, because like I said, my mom comes from the medical field, and our bodies are made up of water, and you really just need to be hydrated, because when you're dehydrated, you're going to be even more tired. Your body's already trying to recover, which it's going to be a little bit more tired. So water gives you energy, and it makes you feel better, and it helps with the recovery. So I did that. And I also made sure, like, I stopped and got a smoothie instead of, like, because if I wanted ice cream and I wanted, chips and all that, but then I'm going to feel even more sluggish. So during recovery, it's a really important time to look at it as a journey of healing and recovering, because the better you do, you guys, the faster you're going to recover. I literally felt 90% at 3 weeks. Like, and it's because of the way that I handled recovery. I know a lot of people, or some people, I talk to people who have great recoveries, and they're like, I did X, Y, and Z, and that's how I was. I moved my body every day for the happy endorphins. You don't have to run a marathon. You don't have to go outside, like walking circles around your house 15 minutes every hour, or doing something to move your body. And then the water thing, and then the eating, like, get rid of the garbage, eat whole foods, and you are gonna recover very well. And you're in a lot.
Very, very, very important. You said you had a smoothie. Smoothie has all the fruits, vegetables, right? The antioxidants, the vitamins. You don't need to go take a vitamin C pill. That smoothie is your vitamin C, the vitamin B12, all the nice and all the good nutrients. And you can do this at the comfort of your own home. What you said, the whole foods. Very, very important, Michelle, that you're highlighting. You are what you eat. No soda, no pop, no bag of chips, none of this unhealthy food, no greasy, oily stuff, none of this white rice, high glycemic index. You're eating healthy, you're eating smart, and that, believe it or not, it adds to your recovery. What you mentioned earlier, 10 minutes ago, protein. You need protein. So, for example, a couple of eggs 2 times or like once per day, that is good protein. Or nowadays, you can get some protein drinks. These are very important. Again, these are the amino acids, the building blocks. They really help in recovery. No questions asked. Now, sometimes people don't eat right. Guess what? Their wound healing, their healing properties are altered for the worse. And again, it is important to eat smart, eat right, the whole foods, such that your body recovers and benefits from these nutrients, these antioxidants. Now,
I
now
agree.
one, yeah. Now, tell us more about your. Now, you told me earlier, and I remember my other patients were calling me and said, "Look, Michelle's walking 6 miles on the treadmill, and how come she can do that? And what's going on? Do you want to caution her?" Now, tell us more. Now, one thing I really admired what you said is like, I really like my binder, and I tell my patients the binder is the necessary evil. But I'll tell you, please tell us more what you think of the binder.
Well, the binder helps hold everything in place, so it's very important. And I know that in the medical field that if you don't hold it tight, like after my C-section too, it can cause, blood clots and stuff. So like everything needs to be tight together. So really that's just a given, and you'll know if it's not tight enough. Like when you go to like do something, you can just feel more, like even when you get help getting up or something, you can feel it. It needs to be tight. When it's not on, like you can realize, like even when Dr. Khan said you can, not sleep with it, you can tell that it helps with keeping you tight and not moving your arms, if that makes any sense. So the binder was great, especially for working out, walking, because I literally had my arms like this on my phone and I just walked around. Like I walked around like this. And like you can walk, you can still move, you know what I mean? Your arms, you just have to have them tucked into your sides. So Dr. Khan was concerned about my treadmill. So the vibrations of it. And I'm like, driving in a car is like, even coming home from surgery was like more vibration than my treadmill. So you guys will know when
Absolutely,
you
very well said. No, very well said. You get more vibration from the many potholes here in Michigan than you would from a nice treadmill that you likely have. And you can walk gently. And remember, I encourage you to walk. I encourage, and you did a very nice job. And you were very smart about the walking. And you were walking without putting added stress. You had the bra, which is the surgical bra, the Haga Prima, and also the binder nicely snug, where it helped not only with the recoil. Now, another thing I want to highlight, what you said very nicely, is it helps keep everything in. Now, I will tell you, and whenever I do any gynecomastia surgery, whenever I do any tummy tuck, 100% of my patients, 100% of my patients have that garment, the Marina garment, or the abdominal binder that holds everything in place, to the point where I will say anyone who has like the gynecomastia surgery or a tummy tuck and they don't wear compression, that's malpractice. That is bad practice, and it will only lead to problems. So just like someone has like a nose job and they have a splint or like a facelift, you wear the garment, right? So in plastic surgery, whenever implants are removed, that void where the implant is sitting, plus the capsule, plus the swelling, the inflammation that's present, we need to contain it, not only with compression, but also a recoil. So when you twist and turn, just like you said, when you walk about, when you do your really regular chores on a daily basis, there is no movement, shear forces up and down, and that you're held nice and secure. And just like you said, it actually helps you with your pain and post-op pain control, soreness, and also helps you with the recovery. And just like you very well said. So it is very much, I will say, the standard of care. And this is, how long do we wear or have our patients wear the, after our tummy tuck, the garment? 6 weeks, right? So the same thing over here, I have my patients wear it, and this is an extension of what is, the same plastic surgery principles to help with explant surgery. Any good reputable plastic surgeon will have their patients wear the garments for the 6 weeks, so it helps with the optimal recovery. And actually, believe it or not, just like when you fall off a bike and you put pressure on, it helps with the pain, right, on the road rash that you get on your thigh. The same thing when you put pressure on your chest with the bra and then the binder that gives you a nice recoil, that actually helps you post-op with the pain control, and also helps keep everything together, forced and firm, such that when you move, it doesn't cause the shear forces, and it
Yeah.
actually helps with the recoil as well. So very important points. These are your words, and I'm just clarifying. And every time you said something, I'm like, I'm put you on, because everything that you have said, what you have said, my patients and other patients can benefit from all what you have said, because this is very practical aspects of what is not only explant surgery, but any other surgery itself.
And I was
Now,
never in pain. If you feel pulling or you feel pain, you should probably take it easy. Like it's not like I was walking to the point where I was like, I'm in so much pain. Like I listened to my body. Like everything felt fine. I was walking at a slow pace, and the binder helped a lot because I washed it one time on a 15-minute cycle, and it helped. It helps a lot with keeping everything in and tight, and you can just get around a lot better.
right. Now, another thing I want to mention, this is my regimen. So this is what I give my patients for pain. I have them, if they're, now the first thing I ask my patients is, what have you taken in the past for pain? So they say Percocet or Norco, and I give them because this is what they're used to. I don't want to give them what I'm used to, what
Yeah.
they're used to, because each patient has their own experience. If they like Tylenol #3, Norco, Percocet, Tramadol, and I only write it once. I am not a big fan of pain meds at all. But after a surgery like this, where I'm dissecting off of the rib, the patients have earned the pain medications, because I don't want to be in discomfort. So I tell them to alternate, and this is kind of my go-to if they have not had any pain meds. I tell them to take Norco, which has the narcotic and the Tylenol in it. It's a 6-hour acting pain medication. It causes constipation. It also causes some loopiness. And remember, it's addictive, so that's why it's a controlled substance. So I have my patients only take it if they have 3 out of 10 pain or more, and they want to be on top of the pain rather than chasing the pain. So if you're 0 out of 10 pain, 1, 2, or 3, don't take anything. If you are 3, 4, 5, go ahead and start taking half a Norco or 1 Norco. And then if you're still in pain 3 hours from that time of having taken the Norco, you can take a Tramadol, which is another prescription strength pain medication that works on a different receptor, helps with the pain. And so you can alternate that with the Norco, such that you're now attacking the pain from different angles. And if some patients can take Aleve, that's another anti-inflammatory. So between the Aleve, the Tramadol, and the Norco, you can choose using your gut instinct which one will work better for the two, along with the walking, the happy endorphins that are released, along with the garment, the bra and binder that sits on the chest. That helps with the pain. And overall, as you will see, most of my patients do relatively very well with pain. And again, this is something that you want to be on top of rather than chasing, just like you very well said.
I was on top of it. I'm not going to lie, for 3 days, and then I was done with it. Thursday, I had surgery. The second I got out, my husband was amazing. He set his timer for every 3 hours because you have to take the antibiotics too, and you got to be on top of that. So he set alarms and came in the room and just gave me a straw, and I followed your regimen until Sunday. I started to like feel, you know what I mean, like not as in pain, because once you're in pain, it is very hard to chase it. It happened with my C-section. It happened like you. So I know that, and I didn't want to be in pain, and I didn't want to be bedridden. So I did, and then Sunday I was off, like I just stopped and I was fine. So
Sure.
I got
Now now this is again what worked better for you, and you knew down within your gut that this is the right choice for you, and you were on top of it, and you never let the pain kind of get to you because you were ahead of it. And this is your choice. And this is where I ask the patients, absolutely minimize the pain meds. Just look at the side effects of Norco, Tramadol, even the Aleve over the counter. These are bad medications. I use the word bad. Look at all these side effects, right? Even just Aleve, for example, over the counter. How many patients have I talked to that take 800 of the Motrin? I say the 800 of the Motrin should be banned because it's too strong for the stomach, causes gastritis. But Aleve over the counter just once in the morning with food lasts you 12 hours of anti-inflammatory effect if needed. And this is where you want to be comfortable such that you're basically be able to recover from the surgery. And every day, the patients recover optimally, the pain gets less and less, the swelling gets less and less. Now, the other thing I wanted to ask is now at the 3-week mark, again, you followed my instructions down to the T, and I have to say you were my exemplary patient. And I told you, and I said to the first point, I said, I'm going to bring you on Facebook Live, and here we are again. Now tell us how and what did you start doing at the week 6 mark?
3 pound weights. And so I do 3 pound weights to strengthen everything back up, and it's actually going very well. Like I said, you can feel kind of a tug if it's too much, because I started off with like twos. Sometimes I can do, yes, I'm just doing the threes, and I'm weightlifting. I do the stairs, walking the stairs, while I hold on like this, because I can still do that because I go on like a machine, and then walking every day. Like everything's just continuing, and it's only getting better. And then the massaging, and the ointment back and forth for the scars. So, or for
Yeah,
the,
no,
not the,
very, yeah, very important. When you massage, and again, if this is the scar right here, when you massage in a circular fashion back and forth and the entire chest, the nipple areola area, the whole chest, what it does is it calms those nerves down, which went haywire, especially over the incision and over the inflammation. It causes nerves to come in an orderly fashion towards the surface. It moisturizes the skin. And also the everted incision area, it's going to settle down. That's the 4-layer closure with what is dissolvable sutures, the Stratafix double layer, and then the 3O Vicryl. That also helps with the recovery, such that when you pass your hand over in the next 3 to 6 months after and up to a year, this is how long it takes for the incision to settle, that you're able to have normal sensation and feelings, not only over the incision, but over the entire chest, which was once a lot, where there was a lot of inflammation. Now, the other thing that you had mentioned was, in regards to, listening to your body, your sixth sense, as far as recovering. So when you get the 3 pound weights and when you're working out, what it does is you're not only building the pec major, the pec minor, the latissimus, the deltoid, the serratus anterior, and all the muscles of the chest. Remember, the many ladies, just like you, who have had implants below the muscle, which is the pectoralis muscle, the pec muscle essentially is compromised, and you truly have not been using your pec muscle for all these years, because every time you used it, guess what? It would press against the rib and it would compress the implant. It would be an awkward feeling. And this is what I tell my patients. Imagine the implant was sitting below your thigh muscles and I asked you to run. You would press the implant against your femur, right? So in the same way, the implant was sitting on your chest and the pec muscle would kind of crush and compress the implant against the rib. So now all of a sudden, once the implant is gone, the muscle wants to settle. After the 6 weeks of recovery, when you start flexing and extending, you're going to know that atrophied muscle, that muscle that you are not using, will not only get stronger, where you're now actively building the muscle, but it will also, because remember, the muscle attaches and inserts into the upper arm, the humerus. So now you're going to flex and extend and work. Not only will you build the shoulder, but the infraspinatus, the supraspinatus, the entire neck and back, and the trapezium. And remember, as you have seen, and I posted this article in my Facebook, the posture changes because of the heavy implants and the inflammation. The patients don't want to kind of sit up straight, and it affects the posture. So now you're going to be, the upper neck and back symptoms are going to be enhanced and improved upon, such that now those fibromyalgia type symptoms are going to improve, and such that some of my patients have become athletes and they work 1 or 2 hours in the gym every day. You can see how they have built all that muscle mass, and you get your upper extremity back like you have never before. One thing I want to highlight is, once the implant is sitting underneath the pec muscle, and this is my pec muscle and inserts into here, the entire anterior stability of the shoulder is gone, simply because the pec muscle does not sit tight and the muscle has window shaded up, because usually the muscle is cut on the side to allow for 300, 400 cc implants to sit. And now the anterior shoulder is destabilized as a result, and now you have unopposed basically backward movement, along with the weight of the implants plus the inflammation, all of that compounding into upper neck and back pain, if you will. So the cutting of the pectoralis muscle in itself is a very traumatic part of what is augmentation surgery. That in itself is a reason why athletes, bodybuilders, weightlifters, these ladies, they get their implants above the muscle, so that almost all the personal weight trainer patients that I've managed, who are like Florida, for example, I remember she, as another lady I took care of in my operating room, she had implants above the muscle for that reason, because she did not want to compromise her pectoralis muscle function, simply because her nature of her work was bodybuilding, and she did not want to compromise that aspect of her functional capacity of working and being a bodybuilder. Yes, please. So very important, as you work and exercise, you're still recovering, but over the next, you're listening to your body, your gut instinct, and you're training yourself so that such that you're going to the next level up, and you're building your upper strength, upper shoulder and upper arm strength like never before. Now, what I'm going to do is I am going to ask our viewers, if you have any questions, feel free to ask Michelle or I myself so we can clarify. Now, Michelle, the other thing I wanted to ask you is, you know, as you, what, when you were researching, uh, like as far as to explant or not, like how did it even catch your attention that, you know, there's such a thing called breast implants? Because right now they say there are millions of people out there who have not even heard of breast implants. I talked to a lot of ladies who like, I just heard about it just 24 hours ago from a friend who told me that this is basically what's going on. And I say this is, and again, another purpose of this Facebook Live, where we want to bring awareness. We want to discuss your journey. You know, had you had implants, you can only imagine where you would be in the same state of, quote, silicon toxicity, where we want to spread awareness. What is it that brought to your attention that breast implant illness even exists? How did you hear about BI for the first time?
I heard. Can you hear me?
Yes, I can hear you just fine. Yes.
So when I was talking to people on social media and trying to recruit people into, I realized like what it, and found your group. Someone recommended you, and I went in your telling people that I was getting surgery. Everyone, what are you getting surgery on? And I'm like, that's really good. You should get those. Like, like, why are you taking off 6 weeks, getting my breast implant out? And they're like, can I ask if you're doing that? Like, it's.
Michelle, I'm getting, you're breaking up, coming in and out.
You're breaking up too, Dr. Khan.
Okay, so now this is relatively clear. I'm hearing someone basically mentioning that they cannot hear, you're breaking up. No, I see what you just wrote. Can you hear me now? Okay, so this is what I'm going to do now. I think let's go ahead and connect again, if that's okay, just like we did, so that we can continue on. Unfortunately, this happens.